Hi, it's Paul Foyers, the editor-in-chief of Dentistry Today. And I'm here with Anthony Ponzio. Anthony,
How you doing?
how are you?
Nice to meet you.
Anthony practices in the Chicago area, I assume.
Yes. Yeah, about 20 minutes west of the city. Yeah.
And he's taken the digital journey from way back. And I would say that your office is probably digital, and more digital.
That's pretty accurate, yes.
And the core of everything, no pun intended, is the Dentsply Sirona workflow.
Yes.
So you've worked with Sarah and all the different permutations, right now with PrimeScan and moving on. But you're a GP.
Yes.
So one of the parts of GP work is orthodontics. So you have patients coming in on recall, and you come to do an exam, and you go, hey, we do this little refinement over here. Well, I had braces when I was a kid. Well, we could do aligners. Well, we do it all digitally. We have magic tricks and things like that. So how do you present that to your patients in terms of aligner therapy in general? Sure. About what's going on.
Yeah, no, it's a great question. So we've found that really having the team involved helps. It's a little bit less threatening. Our hygienists and our assistants have already had some type of a conversation. And I really work with them on listening to cue words from the patients, right? They mention they're always building up plaque on their lower front teeth, or they keep chipping a tooth, or they have trouble flossing or brushing. All those types of things are just little triggers to our team to say, well, there's ways to correct these issues. Because for a lot of patients, they kind of believe that they're just too old for orthodontics. That's their first reaction almost all the time, is I'm too old, or I don't have any options. And from our standpoint, it's all education, right? That most people aren't aware that they can do this, or this is an opportunity for them to get better oral health and to improve kind of what's going on in their mouth. It's not just a cosmetic issue. So we really just try to open their eyes to what's possible. Oftentimes, even if it's a case where I know I'm not going to do it in the office, someone's got a whole bunch going on, they need jaw surgery, whatever it might be, I still want to open that conversation and let them know, this isn't a life sentence for you. If there's something you'd like to change, there are options, whether it's with me or whether I need to send you to someone else. We can get you where you need to go.
I'm sure you discussed the health benefits of, it's easy to floss now, it's the periosystemic thing, all that sort of thing like that too, which is very, very helpful. So in the workflow of Dentsply Sirona, you have the OmniCam, you scan the patient, and then you can show them on the screen what.
Yeah, no, it's a great question. So that's been, just to go backwards a little bit, that's been the fun part, is watching the evolution of the technology. I started back in the blue cam days where we're spraying powder on the teeth, and now we have PrimeScan, which to me is unrivaled as a scanner, because we're able to pick up information really quickly. So for our patients, we're scanning them, and then we upload into DS Core, which is a software in the cloud that actually has a simulator built in.
Let's hold that thought, because I want to talk more about DS Core.
Okay, sure. So it's fun for the patients, because while they're in hygiene or while they're in the chair, we're able to show them at least a simulation of what their teeth are going to look like after, and now their mind starts to really run. They say, oh, wow, this is exciting. That's me. This is what my teeth will look like when they're in a better position. And we can also give them a visual of, here's why it'll be easier to clean your teeth. Here's why your bite will be better. All these different things that kind of touch kind of the emotions of the patient.
That's a great thing. So you're presenting all this, and it's fast enough that you can do these things. So let's talk about DS Core just for a second, just to explain how that all works. It's taking all this digital information, your photographs, the cone beams you have, the scans, and it's all in one spot, and you can put this all together with that software, the simulation software.
Yeah, that's the beauty of it, is all I do is scan, and it automatically gets uploaded, and now we have this digital patient that we're able to access from anywhere. And there's a lot of different things we can do with it, whether it's sending something to a lab, sending it to a printer, whatever you need to do. But from a SureSmile standpoint, it instantly is in there, and I can just click a button and get a simulation very quickly. And now I have that patient there, and I can open it up on any computer. I can send them a file. They can see these different options and opportunities for themselves, and now it becomes real for them.
And also, if I understand Core correctly, if there's some questions that you might even have, you can plug other people into that.
Yeah, that's the beauty, is you can share it with other dentists, specialists, whoever you need to actually share feedback. And DS Core happens to be able to take your cone beam scans, your digital impressions, photos, and you can now share them with people that you're working with and have true collaboration in your cases.
So if you're going to do a case with SureSmile, what's the actual workflow at that point? So I've come to your office, I said, you did early correcting for me, what can we do? And I looked at the simulation, I go, wow, that's pretty cool. Now what do I do? What's next?
So that's the beauty of it, is then you can go right into the SureSmile software, you have your photos uploaded, you have your scans uploaded, and you could write in your treatment plan. Here's what we're trying to correct. here's what we're looking for: a limited treatment to just straighten in a couple front teeth, or let's correct everything and get their occlusion dialed in and really make wholesale changes. And once I put all that information in, there's an actual digital lab technician who's on the other end who's looking at it, building the case. It's not just a software algorithm. So you have a person looking at it and saying, this is possible, this is how it would work. Within 48 hours, generally, I have a full workup of how the movements are going to happen, how long it's going to take, where I might run into pitfalls, or what movements might be more difficult.
So it alerts you up front saying, this might be a little challenging.
Yeah, and because there's a person looking at it, they're aware of what's really possible and what's not. Sometimes if it's just computer-based, they're going to act like you could spin a tooth 180 degrees, which isn't feasible in the digital aligner world. So what I really like is that there is a human-to-human interaction in the treatment planning side of it, and then it's quick. So my patient was excited. They were in. They're looking forward to it. Within a couple days, I'm showing them, hey, we're ready to go. If you like this, let's keep moving forward. And generally within 2 weeks, the trays are in my office and we're getting rolling.
Now, one of the things that I've seen with some of the systems is that you're working on a case, and all of a sudden, in the middle of the case, something goes screwy, and you have to do some refinements. I understand that this is a much more sophisticated system.
Yeah, it's a great system. Generally we see things track really well. So we see a lot less refinements with SureSmile than I have with other systems. I would say probably 3/4 of the cases finish with no refinements whatsoever. The other nice thing is the way that the technology is designed in the actual aligners, we see less attachments, we see quicker treatment times. So for our patients, it's more comfortable to wear throughout, and the process goes quicker. So now when you're talking to a patient and they're picturing 18 months of treatment and we're going to be done in 8 to 10 months, you're like, wow, so by my next hygiene appointment, I'm almost done? Yeah, I'm ready to do that. So really, we just see the predictability, which as dentists, we generally are a little type A, right? We want everything's going to work how we expect it to. So it's nice to know, hey, if I plan this and this is what I expect to happen, it's going to happen.
What about, I know that there's a high-end version of this thing with a complete package with all sorts of other things, like vibrating things and stuff. Tell me a little bit more. I don't really understand it, so you'll have to explain it to me.
Yeah, so I generally do a complete case on everyone. They have a limited treatment option. The advantage of the complete case is your patients get unlimited refinements for 3 years. So if something doesn't go well, they have the ability to refine it. It comes with whitening. And then it also comes with something called the V-Pro, which is an ultrasonic vibration device that helps you, in certain cases, you can actually go to shorter time in between aligners, and then also it makes the trays a little more comfortable, makes them seat a little better. So I think that really helps contribute to making sure treatment goes as planned.
That's amazing. So I guess I have a hard question. This is a hard question. Do I have to use a PrimeScan?
It's a fair question. I would recommend it because I think it's the best scanner we have. However, no. Any scanner that can actually produce an STL file can be used. So that's one of the nice things about SureSmile is they just want a good, clean scan. You upload it, and you can go ahead and use that system.
Of course, you're not going to have DS Core and all these other things.
Right,
but,
correct.
So there's being one-stop shopping. But I had to ask.
Yeah, sure, yeah.
Well, this has been great,
Yeah,
Anthony.
definitely,
Really, a lot of information.
Yeah, nice chatting with you for sure.
And they get the information from, I believe it's SureSmile.com.
Yeah,
SureSmile.com. Where you can go to Dentsply Sirona's website, look around, talk to Anthony, talk to anybody who's used SureSmile, get some information, and get going with this stuff.
Yeah, definitely. Thanks for having me. Yeah, it was nice chatting with you.
Great.
Absolutely.